Good morning, everyone. Today I'm going to be presenting my research on fear acceptance versus fear reduction for arachnophobia. So first, let's understand the why of this research. Specific phobia refers to an intense and persistent fear of a particular object or situation that interferes with one's life and has been associated with aversive outcomes. Approximately 9.1% of U.S. adults suffered from a specific phobia in 2017, and an estimated 12.5% of U.S. adults experience specific phobia at some point in their lives. And it's important to point out here that a significantly higher percentage of individuals experience similar levels of fear, but may not meet diagnostic criteria for specific phobia. And on the right, we just have specific phobia examples. Of course, this research focuses on arachnophobia, which is fear of spiders. And so the purpose of this research is to test fear reduction and fear acceptance in augmented reality exposure therapy for specific phobia. Emotional processing theory, or EPT, has been the traditional framework for exposure therapy. So emotional processing theory, or EPT, relies on a process known as habituation. And here, habituation refers to the gradual reduction of fear when in the presence of the feared stimuli. So for example, if we had an individual who was arachnophobic, in EPT-based exposure therapy, we would be focused on the reduction of fear levels to indicate successful treatment of the phobia, or successful extinction learning. However, there have been significant limitations to the emotional processing paradigm. Mainly, emotional processing asserts that the amount to which fear reduces within an exposure session predicts successful treatment of the phobia, or successful extinction learning. And this is where inhibitory learning theory comes to the picture. So inhibitory learning theory, or ILT, relies on fear acceptance, not fear reduction, to encode a new non-fear memory when in the presence of the feared stimuli. So using the same example in ILT-based exposure therapy, we would encourage the phobic person to notice and accept their fear. And this is meant to form a new memory around the stimulus that they fear, which is basically the memory that they can be in the presence of a feared object or situation without an aversive or bad outcome occurring. And so to reiterate, the purpose of this research is to test fear reduction and fear acceptance methods for arachnophobia. And here we have a basic graphic of classical conditioning. On the left, where it says before exposure, you see that the spider, or the conditioned stimulus, the CS, is paired with an aversive stimulus, which in this graphic it is being bitten on the hand. And this creates a fear association, or a fear memory. And so the spider itself will come to elicit fear and anxiety. Now with inhibitory learning, on the right where it says after exposure, we are trying to form a new non-fear memory, or a non-fear association, by presenting the spider without the aversive outcome occurring. So presenting the spider without being bitten on the hand. And this is meant, again, to form a new non-fear association. And so what are the main points of inhibitory learning theory? Well, it's important to note that the original CS-US association is not erased. And that CS-US association refers to the fear association that we spoke about on this slide, on the left-hand side. That fear association is not erased. Instead, it remains intact, but we are trying to encode a new non-fear association which will compete for retrieval with the prior fear association. And so how are we doing this in our study? So we're going to be testing fear reduction versus fear acceptance psychoeducation. Psychoeducation refers to the active dialogue between the therapist and the participant, in which the participant is educated and informed on their condition and pertinent treatment. So the psychoeducation scripts used in our study are similar for the fear acceptance and fear reduction groups, in that they both refer to the technology being used to facilitate exposure, which is augmented reality. However, they differ in that the fear acceptance script is aiming to educate participants to notice and accept their anxiety as it arises, whereas the fear reduction psychoeducation is informing participants to try to stay in the feared situation until fear habituates or reduces. And so the idea here is that the psychoeducation script sets the direction of the succeeding exposure session. So what does our methodology look like? Well, a small sample, we have 4 participants, and they're going to be pooled from 18 to 60-year-olds from Eastern Michigan University. And of course, the main criteria is that they must have a significant fear of spiders. We have 2 conditions. We have the fear reduction condition, and we have the fear acceptance condition. And there will be 2 participants in each condition, with the independent variable being the psychoeducation script. So to be clear, the fear reduction condition will be receiving the fear reduction psychoeducation, and the fear acceptance condition will be receiving the fear acceptance psychoeducation. And before we go on to the next slide, for anyone who might be arachnophobic in the audience, there is a picture of a tarantula on the next slide, so this may be a time where you'd like to look away. There's only one picture of a tarantula in the entire presentation. It's on the next slide, so I'll give a couple seconds for anyone who would like to look away. Okay, so what does the actual experimental session look like? Well, there's going to be 10 minutes of psychoeducation for both conditions. And then immediately after the psychoeducation, the participants will go into 80 minutes of augmented reality exposure therapy. And on the bottom left-hand corner, you see a picture of what augmented reality sort of looks like. It's often confused with virtual reality, which is completely different. With virtual reality, you're putting on goggles and you're in a completely different world. You don't see any of your actual environment in virtual reality. With augmented reality, you are often looking through a camera or sometimes goggles, and you see your actual environment, except it's augmented or enhanced with virtual objects. And so after the 10 minutes of psychoeducation for both conditions, the participants will be entering 80 minutes of augmented reality exposure therapy. And so what are we measuring? Well, we have 5 measures, but essentially we're measuring expectations, distress tolerance, and subjective fear and anxiety. We will be measuring expectations in that we will assess how much participants expect the exposure session to help improve their functioning. We will also be measuring how much distress our participants can endure before and after the experimental session. And the idea here is that the fear acceptance condition, which is the condition that is receiving the fear acceptance psychoeducation, will improve the amount of distress an individual can tolerate. And lastly, we are measuring subjective fear and anxiety by asking participants to report to us the fear and anxiety they are experiencing throughout the exposure session. So why choose these measures? Well, we want to measure the amount to which the fear acceptance is effective in comparison to the fear reduction. Again, to reiterate, we expect that the fear acceptance condition will improve the amount of distress an individual can tolerate. And we have that listed here. Improvements on all of the subjective self-report measures. Essentially, we are expecting the fear acceptance to be more effective than the fear reduction condition in improving the functioning of the participants who are arachnophobic. We also expect less improvement on one measure, which is the SCR. Essentially, that stands for skin conductance response, and that measures sweat. So electrodes are connected to the participant's palm, and it measures their sweat. And we are expecting the amount of reduction in sweat that we see in the fear acceptance condition to be, we're expecting less reduction than in the fear reduction condition on that same measure. But as was pointed out in the beginning of the presentation, fear reduction is not reliable for predicting successful treatment of specific phobia or successful outcomes. And so what are the primary themes here? Essentially, there are significant limitations of the EPT paradigm, and ILT, or inhibitory learning theory, suggests more effective methods, which is basically moving away from the reliance on fear reduction or habituation to a reliance on fear acceptance and fear toleration, again, to form new memories in the presence of the feared stimuli, which will compete for retrieval with the prior fear memories or the prior fear associations. And I'd also like to point out here that ILT-based exposure is not specific to arachnophobia. It is just that we are studying arachnophobia and ILT's applications to arachnophobia in this particular study. And what are the next steps? So we'd like to increase the sample size. Of course, this sample size for this pilot study is at 4 participants. We'd like to get it up to about 30 participants. And we'd also like to add a control group. And we also like to add 2 follow-ups, one a week after the experimental session and another a month after the experimental session. And lastly, we'd like to add 1 more measure, which is the behavioral approach test. And I'd like to thank Dr. Cook. She has been a great mentor throughout this entire process. And I'd also like to thank her graduate students for helping me since last summer. And I'd also like to thank Dr. Neff and Dr. Kimberly Brown at the McNair program for all the opportunities they've been giving me. Thank you.